Joining us on the line, we've got Karyn Wesselingh.
Dr. Karyn.
I'm sorry, Dr. Karyn Wesselingh is an emergency vet with the Animal Referral Hospital at Baulkham Hills. G'day, Karyn.
Hello, nice to talk to you.
Likewise. Now, Karyn, have you seen in particular an increase in dogs affected by heat this year?
Oh, without question, yes.
In what way?
A lot more dogs being left out in backyards and people going off to work. Animals being taken for walks in the heat.
Uh-oh.
Not so many cars, but certainly this year, but I think because the weather's been exceptionally hot and then it's cold and then exceptionally hot, and despite the media giving us lots of information about predicted hot days, people don't seem to be realising that they need to provide their animals with shelter and water.
So what are the signs and symptoms that people are seeing for dogs that are heat affected as opposed to affected by heat stroke?
Well, I think in the first instance, when they first get stressed with heat, they'll start panting and their heart rate will go up and they can become quite red, dribbling, salivating, that sort of thing. Mm-hmm. And that the panting particularly for most people is what they notice first. But as the heat stress gets worse, the symptoms change and then they start to become weak, they collapse, they can start vomiting, bleeding, and they can start seizuring.
Oh dear. So that's the worst case scenario, yes. But even with the early symptoms, what does all of that heat, like being in a sauna and not being able to get out of it, what does that do to the animal?
Well, as the body temperature goes up, obviously all of the cells in the body are heated up. It's basically like sticking a piece of meat in an oven, and that it changes everything and it damages all of the cells in the body. And sometimes that damage is irreversible.
And if people think they have a heat-affected, possibly heat stroke patient, an animal, what should they do? What's the very first things they should be doing?
They need to cool it down first. So obviously they need to provide water, cold water, and they can put it into a bath, a cold bath, but just as good is to use just cold towels that have been put in cold water and wrung out and put them over the dog and put them in front of a fan so it evaporates that water from the towel. So the idea is to cool them down, but not too quickly. So don't stick them in a bath of ice cubes or something like that. It needs to be cold water, but not freezing.
But the next best thing, of course, is to go and see you?
Yes, obviously. So if the dog is collapsed or appears dull, not responding to you, or seizuring or vomiting or anything like that, then they need to get it to an emergency vet straight away or to a veterinary surgeon straight away.
Lovely chatting with you, and let's hope that we can chat about some happier events and some animals perhaps that you guys end up saving on a daily basis at the Animal Referral Hospital.
Okay, thank you, Brian. Okay.